There are weight loss surgeries that are based on restriction, which means limiting the amount of food that the patient can take. And there are certain procedures that are also malabsorptive procedures, which means that the amount of calories that will be absorbed after the patient eats, it's going to be limited as well.
The most widely practiced operation in the United States at the moment, and there are over 100,000 of these performed every year, is the gastric bypass. In this operation, the upper part of the stomach is disconnected from the rest of the stomach to form a small pouch, and a loop of the small intestine, so-called roux loop, is taken up and joined to this, so that when the patient eats, they swallow down the gullet in the normal way. They fill this small pouch and feel full, and they empty rather slowly through the loop of intestine or the roux loop. The rest of the stomach is excluded from the passage of food, taken out of circuit, but it remains in the body. The lap band is a silicone cuff which sits around the upper part of the stomach, creating a constriction with a small pouch of stomach above it. When the patient eats, they fill the small pouch and empty slowly through the outlet which is created by the band. The size of that outlet can be varied by inflating or deflating a balloon which exists inside the band. This is done by sticking a needle into a port which is placed below the skin on the abdominal wall, and as fluid is introduced, the balloon tightens and decreases the size of the gastric outlet. And it's a question of regulating this in such a way that the patient's emptying is fairly slow, but nonetheless that they're not vomiting or getting any discomfort or anything like that. The gastric sleeve is a new operation whereby the outer part of and the greater part of the stomach is removed. A staple line is used along the whole length of the stomach to create literally a sleeve of narrow stomach. And the rest of the reservoir capacity of the stomach is taken off and removed from the body, so that is an irreversible procedure. By and large, the gastric bypass is the one which creates the greatest weight loss, and we do have experience over now almost 20 years which shows us that the weight which is lost on the whole is sustained, so that the amount of weight which will be lost with that operation is good. I've never done a gastric bypass on anyone who hasn't lost a lot of weight. The lap band has to be regarded more as an adjunct to dieting, and with close supervision and good compliance, excellent results can be obtained with the lap band. But it's usually done, certainly in our practice, for people with lower body mass indexes than we would recommend the gastric bypass to.
We see weight loss surgery as a very safe procedure. We feel that the risk of having a complication is significantly less than having a complication related to obesity in the long term.
There are risks associated with all forms of surgery, just that there's a risk to driving down the freeway. The risks are small, and over the years the complication rates have come down with improved techniques.
It's still trying to overcome the bad reputation that it had 15 or 20 years ago when the procedure was first being done, when learning curves were happening between the surgeons and the procedures. It has been compared with other very commonly done procedures, and the complication and the mortality rate are much lower than a lot of the procedures that are daily performed.